Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Lagos unveils climate action plan at its 8th International Climate Change Summit. And environmentalists speak on the effect of the environment on the coronavirus pandemic. And Scotland considers vaccinating 12 to 15-year-olds as it awaits experts' recommendations. And while the threat of a third wave sweeps across Africa as COVID vaccine imports dry up for the first time in Nigeria, Ondo State Southwest topped the infection chart with 30 cases. This is out of last night's confirmed cases. Let's take a look at the update.
Nigeria continues with a trend of low figures of daily COVID-19 infections, as data from the Nigeria Center for Disease Control, NCDC, shows 49 new infections reported from 5 states in the last 24 hours. Ondo State tops the list with 30 cases. Lagos recorded 15. 2 cases were reported from Kaduna, while Gombe and Adamawa had 1 each. With the latest figures, Nigeria now has a total of 166,816 confirmed cases. There's been 94 additional recoveries in the last 24 hours, increasing the number of discharged cases in the country to 163,190. There were no new deaths as well, leaving the fatality toll at 2,117. The Director General of the World Health Organization says the world is facing a two-track pandemic, even though COVID-19 cases and deaths have declined in recent weeks. This was at a recent media briefing while making calls for donation of vaccines for developing countries.
Increasingly, we see a two-track pandemic. Many countries still face an extremely dangerous situation, while some of those with the highest vaccination rates are starting to talk about ending restrictions. In countries with the greatest access to vaccines, we're seeing a decline in mortality among older age groups. In these countries, the public health and social measures that have helped to protect people are being eased, but they must be eased cautiously.
According to the African Center for Disease Control and Prevention, Nigeria has administered over 2 million vaccines of the first dose of AstraZeneca vaccine to its eligible population. Globally, more than 173 million confirmed cases have been reported from several countries, while the death toll has surpassed 3.7 million.
And NCDC epidemiologist Chioma Danwafo joins us now via Zoom. Thank you for joining us on the program. Give us a brief overview of week 21 and week 20. What are we doing better, and are the cases dropping in terms of the virus course?
Good evening, Millicent. Good evening, Nigerians. It's my pleasure to be here. So taking a look at week 20 and week 21, we've observed the total number of 296 cases in week 21, which is quite lower than what we observed in week 20. But then this decline has been consistent over 2 months now, following our second wave in country, where we recorded very high number of cases and with attendant deaths. But then we're also not testing as we should. That's why we may not be detecting the actual number of cases that are in circulation with respect to COVID-19. So what we are trying to do now is to scale up the testing across states. And we've introduced the antigen-based rapid diagnostic test kit. We are now taking the test to the people so that this test, rapid antigen-based RDTs, can be used in closed settings like schools, hospitals, correctional facilities, and offices, and and other closed settings. That way, the turnaround time is quicker, and we can be able to isolate positive cases and follow up their contacts.
Is there in any way a drawback from the delay in states reporting and case surveillance? And, you know, isn't there a likelihood that this will breed a sort of nonchalant attitude to the virus among citizens, especially, you know, looking at the low, very low non-pharmaceutical interventions?
So across the state, looking critically at what is happening now, we've observed low adherence to the pharmaceutical interventions. That's the physical distancing, the use of face masks, hand hygiene, and avoiding mass gathering, as we have advised. But this more or less is because cases, people no longer have that high risk perception about COVID. But then if we have a case in the country, we are still at risk. We cannot afford to have what is happening in countries like Brazil, Turkey, and India come to us now in terms of a third wave with high number of deaths, because the virus, the variant of concern now has very high effectivity with much more higher severity.
All right, we'd like to appreciate your time. Thank you so much, Chioma Danwafo, and CDC epidemiologist. Thank you for joining us on the program.
Thank you for having me.
We'll move over to Lagos. The COVID-19 pandemic has prompted the state government to unveil a climate action plan with issues of climate change in the state. This was announced at the 8th International Climate Change Summit, where environmental experts gathered to proffer solutions that will achieve a One Health approach that will keep everyone safe from various communicable diseases.
The theme of this year's summit, adapting health, energy, agriculture, transportation and waste infrastructure to the long-term impact of climate change in Lagos, is very timely at this challenging time of COVID-19 pandemic, as the world is advocating for One Health approach. This approach, when adopted, will redesign government policies, programs, plans, operation, legislation, research in which multiple sectors communicate together to achieve a better public health outcome.
In the meantime, the risks and challenges to Africa's vaccination drive persist as 8 countries report 30% rise in cases. This is coming as Senegal joins the likes of Egypt, Morocco and South Africa in the list of African countries that have successfully secured the rights to produce COVID-19 vaccines. Well, joining us right now, Dr. Bassi Okosin is the Director, Disease Control and Immunization, National Primary Healthcare Development Agency. He joins us from our Abuja studios. Thank you for joining us on the program.
Thank you. Good evening, Melissa. Good evening, Nigerians.
Good evening. Tell us, the rollout plan of the National Primary Healthcare Development Agency, how much of the priority population have been covered, bound to receive the full 2 doses of the AstraZeneca vaccine?
Okay. The country plans to reach about 112 million eligible Nigerians over a period of 2 years. And we plan to do this in 4 phases. And these phases is majorly dependent on the vaccine availability. We have what we call the Technical Working Group, chaired by Dr. Faisal Schwab, the Executive Director of the APCDA, and where we have all our partners there. Now, narrowing down to the question you asked and how this information is relevant is the fact that for the first phase, remember I've said we target reaching Nigerians over in 4 phases over a period of 2 years. For the very first phase, we have so far received about 3.924 million doses of the COVID-19 vaccines from the COVAX facility and another 100,000 from the government of India. That made it 4.02 million doses that we have received as a country. And for these doses that we have received, bearing in mind the fact that every individual needs to receive 2 doses of the AstraZeneca vaccine to be fully immunized. we divided these vaccines into two. So we have about 2.012 million Nigerians to be reached with the vaccines. These were the number of Nigerians, living Nigerians we targeted to reach during the phase 1. As at today, permit me to inform you that we are Nigerians that we have reached 97.8% of this target population. And all this we can only thank our President Buhari, his vice, the Secretary to the Government, and the Minister of Health, Dr. Hadira, and Dr. Faisal, and all our partners for the support they have given to the team to have this 97.8% achievement till date. And looking at the absolute figure, we are talking about 1,956,318 Nigerians were reached with these vaccines.
Dr. Kose.
2,012,000, yes.
All right. If I may, because we also know that some states are also rolling out the second dose as we speak, but the question has also been, at what point should one take the second dose? Is it after 8 weeks, after 12 weeks, or even after 3 weeks?
Okay. I'm looking at the quality we have and the timing and the number, the expiry date of the vaccines, because we have two sets of vaccines. There are some that will be expiring on the 28th of June. There are some on the 9th of July, and a few doses, about 100,000 on the 29th of July. For those that took the first jab early around March, most of them were given 12 weeks. And then moving closer to the expiry date, those that came late for the late jab were given 6 weeks. The manufacturer recommendation is 6 weeks to 12 weeks. So whether you take it by 6 weeks, you take it by 12 weeks, it depends on the date that the health worker had given to you now at the health facility. Because we want all eligible Nigerians who have taken the first jab to take their second jab and be fully protected against the COVID. So between 6 weeks, 8 weeks, 12 weeks, we are all within the range that is recommended for vaccination for a second dose.
Do you think that there are states where some might only get one dose, and this is due to the limited supply of vaccines? Okay.
Here we want to thank the chairman of the technical working group, Dr. Faisal, and the entire team, because unlike some of what we've seen in some African countries where they took all the vaccines that was given to them and were concentrating on the first dose, here the team led by Dr. Faisal and the rest member of the team took a decision to give only 50% of the vaccines to eligible populations so that the second dose will be available. I will
so essentially,
answer that question
there's enough
vertically
for everyone.
and said that yes, every state will have enough because they only use 50% of the vaccine given to them for first dose, and they are currently on the second dose.
So
as at dates for
Dr.
those who have
Kose,
received the second dose.
just because we need to go in a few seconds, I just wanted to ask now, we heard that we're in bilateral talks with getting more vaccines, because the question is, when are we going to reach the herd immunity needed to protect ourselves against COVID-19? So when indeed can Nigerians, others in the other phases, get access to vaccines?
Now, the president has given all his support, the minister, the secretary of government, the minister of finance, the executive director of finance, everybody is out there to support the team and ensure that additional vaccines come into Nigeria. We are expecting additional vaccines from the COVAX facility. We are expecting additional vaccines from African Union. Here, the government has also entered into discussion with the African Union, where we are expecting about 29.85 million doses that will come in early July. And there are other bilateral discussions with other countries for us to have enough to reach out to the 112 million Nigerians and achieve the herd immunity that you were talking about. So for Nigerians who did not receive the first dose, be reassured that the government is working very hard to ensure that we have additional vaccines to be able to reach all those that are eligible.
We appreciate your time on the program. Thank you. Dr. Basio Kose is the Director, Disease Control and Immunization, National Primary Healthcare Development Agency. Thank you for joining us on the program.
Thank you, Melissa, and thank you, Nigerians. Over.
Welcome back. And flowing from our earlier discussion on vaccination, the Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shoaib, has indeed said that out of the 4 million doses of the AstraZeneca COVID-19 vaccine, over 1.9 million Nigerians, representing about 98%, have been targeted in the first phase. He was speaking during the town hall meeting on COVID-19 vaccination in Yola, the Adamawa State capital, organized by the Presidential Steering Committee on COVID-19. Now, the director is also appealing to Nigerians who have received their first dose to check their vaccination cards for the date of their second dose and ensure that they receive the second dose to gain full protection against COVID-19.
This meeting here today is the second in the series of town hall interactions across Nigeria to afford the opportunity to rub minds with elders and arrive at a messaging strategy for citizen engagement in the ongoing vaccination to protect Nigerians against COVID-19 pandemic.
And one of the ways of flattening the curve against COVID-19 is maintaining proper hygiene. This was re-echoed in Port Harcourt when environmentalists gathered to review human behavior towards nature and the need for improved environmental care. An environmentalist, Mr. Gode Ine, believes that healthy living can only be achieved through a healthy environment, as he asked Nigerians to join in improving the quality of air taken through tree planting. And now we go over to the United Kingdom. Joining us is Dr. Tosin Taiwo. He's a GP registrar in Norfolk in the UK. He joins us now. Thanks for joining us on the program.
Thank you for having me.
How are you looking forward to the so-called Freedom Day, as it's called, in the UK, June 21?
Well, we were looking forward to it, but obviously, as everybody has heard, with the new Delta variant out there, there's a lot of uncertainty out there. We'd planned holidays, meeting up with friends. The usual, mixing up and having social engagement was going to increase, but we don't know. That to be the short answer.
And we understand that Prime Minister Boris Johnson is expected to consult his cabinet this weekend on whether to push back the date or not. But what do you think from what you're seeing on ground, the vaccination, the cases?
From what we've seen, talking about the vaccination push is going quite well. I've been involved in it a bit as well. And it's gone we've moved down the age group now. We're going to the 25 to 29-year-old group. And over 50% of the adult population they've had their second dose, which is obviously helping move us towards the so-called herd immunity that we all talk about. So it's going well in that light. Now, also relating to things on ground, we're a bit, looking up north to see what's happening. That there's been a bit of a pickup of people having a slight surge in cases of the new variant of the disease.
When you say new variants, because, we're hearing tougher restrictions in Greater Manchester and other parts, and this is to combat the Delta variant.
Yes. Yeah. Yes, so the Delta variant, or the Indian variant, as everybody knows it as, there's been a slight surge in the Greater Manchester area. Just listening over the news, our Health Secretary, Matt Hancock, has talked about it. So there has been a slight concern regarding that as well. We think they're putting things in place anyway. Okay,
and you think that reopening will go on as planned?
I honestly don't think so. I suspect the big rumor around town is that they are going to push it back about 2 weeks. So maybe we're looking at first or second week of July. At least that way, the logic probably behind it is that we will be able to have given a larger percentage of people the second dose of the vaccine. And we know from recent data that has been put out there that although the Indian variant is quite viral and the infectivity rate is high, people that have had particularly the second dose of their vaccines are either not suffering as bad or are not catching it at all.
So still talking about, vaccinations, we hear that UNICEF, for example, is calling the G7 countries to send 20% of vaccines to poorer nations by August. What's your take with the way vaccination is almost drying up in continents like Africa and a few other places?
It's definitely a bit worrying. I'm glad UNICEF has done that. Talking about the COVAX facilities that have been put around everywhere, they usually draw all the big companies together and they have a certain percentage that they donate. And I do not know the details as to why they've dried up, unfortunately, but that particular push, I think they'll be discussing that at the G7 summit as well. And obviously for all the developed countries, it bodes well for them to help stem the pandemic in the African countries or in the other sub-Asian continent to reduce the spread to their countries as well.
I'd like to thank you, Dr. Tosin Taiwo, GP Registrar in Norfolk in the UK. Thanks for joining us at this time.
Thank you.
Russia is said to be preparing to offer package tours for foreign nationals willing to get a shot of one of Russia's coronavirus vaccines. According to the head of the Russian Tourist Industry Union, tour operators have already drafted their proposals and are working with the government to sort out visa support and legal entry issues. Here's more on the Global Update.
Global Update continues in Scotland, where First Minister Nicola Sturgeon says children aged between 12 and 15 will start being vaccinated as quickly as possible if recommended by experts. The Pfizer-BioNTech vaccine was approved for use among this age group by the UK's medicine regulator last week. But for Scotland, the focus remains on getting all adults vaccinated.
Hello? Fine, thank you. How are you?
Hospitals in Kenya are stepping up preparations for an expected surge in coronavirus infections, increased bed capacity and stocking up on oxygen supplies. Health Minister Mutahi Kagwe and other experts have warned of a likely increase in infections. He did not predict when the wave will begin, but Kenya's Health Research Institute has warned that it will begin this month until August. India has registered 86,498 new COVID-19 cases during the past 24 hours since Monday morning, the lowest single-day spike in more than 2 months. As many as 2,123 people died due to the pandemic in India during the 24-hour span, raising the death toll to 351,309, and the country's total caseload stood at 28,996,473 today. There are still more than 1.3 million active cases in the country, as there was a decrease of 97,907 cases in the past 24 hours. The number of daily cases has been on the decline over the past several days after a continuous surge since mid-April. Finally, Malaysia has begun rolling out mobile vaccination units in its capital as the Southeast Asian nation ramps up its COVID-19 inoculation program amid a surge in infections. A fresh 2-week lockdown came into force in the country on June 1 as it battles its worst outbreak of the virus since the start of the pandemic. The mobile vaccination units are being used by the government to reach densely populated areas where residents may have difficulty getting to vaccination centers.
Let's continue to take responsibility. You can visit our website for more updates, also a better understanding of the pandemic. You can find other stories there as well. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.